Cardiologist warns, if your nails look like this after 60, your heart may be in danger. Take a moment right now to hold up one of your hands and examine it with genuine attentiveness. This isn't a fleeting glance, it's a deliberate observation. Over the next few minutes, I'm going to reveal something that a significant portion of individuals over the age of 60 have never been privy to. It's information that cardiologists encounter on a daily basis in their clinical practice, yet they seldom allocate sufficient time to articulate it to their patients. Your fingernails have been diligently documenting the state of your heart and blood vessels throughout your entire life, operating as an internal surveillance system. With precise knowledge of what to ascertain, these very nails can serve as an early warning system, flagging an impending cardiovascular crisis before it manifests. As Dr. Hattie, I've dedicated years to assisting adults over 60 in proactive cardiovascular care. It's a recurring and deeply concerning observation that individuals present for treatment after experiencing a heart attack or stroke, and upon closer examination, I find that the warning signals were already etched onto their nails. In some instances, these premonitions were present months, and in others, years prior to the event. The tragic reality is that no one noticed, and critically, no one had informed them of what to scrutinize. Before we proceed further, if you find this information valuable, please take a mere second to engage the like button. This small action significantly amplifies the reach of this crucial message to those who stand to benefit most. Furthermore, I encourage you to share your age in the comments section, alongside any history of heart attack or stroke within your family. I personally review every comment, and your contributions directly shape the direction of my future content. This oversight by the medical community ends today. Please stay with me until the very conclusion, as the final indicator I will discuss is often the most surprising and impactful for individuals. The reason your nails bear this vital information lies in their origin. Nails grow from a specialized structure known as the nail matrix, situated directly beneath the visible portion of each nail. The cells within this matrix are in constant direct communion with your bloodstream, drawing sustenance from the body's most minute blood vessels, the capillaries that thread beneath your nail bed. Due to their extraordinary fineness, these delicate vessels are among the very first structures to exhibit signs of distress when your cardiovascular system begins to falter. Consider your nails as a real-time, continuous monitor that your body has been quietly operating day in and day out. After the age of 60, this internal monitoring system gains even greater significance. In your 30s and 40s, your heart often possesses the resilience to silently compensate for early signs of dysfunction for extended periods, without any outward visible manifestations. However, post-60, these physiological reserves naturally diminish. Warning signals begin to surface more readily, and frequently, your nails are the primary canvas upon which these subtle indicators appear. A standard 15-minute medical appointment is often insufficient to cover every nuanced aspect of patient health, and the examination of nails rarely takes precedence on the agenda unless a defect is overtly obvious. While the scientific research detailing these connections exists, it often fails to reach the individual at home who desperately needs this knowledge. My objective here is to bridge that critical informational gap. Sign 1. Terry's nails. The initial indicator we will explore is termed Terry's nails. This is the designation unfamiliar to most, but once you understand its characteristics, your perception of every pair of hands will irrevocably shift. Terry's nails are characterized by the entire surface of the nail plate assuming an opaque, whitish, or very pale hue, reminiscent of frosted glass. The defining feature that distinguishes it from ordinary paleness is a narrow band of pink or reddish coloration precisely at the very tip of the nail, typically extending only a few millimeters. This distinct strip at the distal edge is the key differentiator from generally pale nails. It is imperative to look for this specific coloration. Extensive research published in the field of cardiovascular medicine has established a significant correlation between Terry's nails and coronary artery disease, heart failure, and diabetes. One particular study revealed that individuals exhibiting Terry's nails possessed an odds ratio exceeding 6 for developing coronary artery disease when contrasted with those who did not present this nail abnormality. This is not a negligible statistical anomaly. It represents a profound and urgent signal. Crucially, all the conditions associated with Terry's nails share a common developmental trajectory. They progress slowly and silently over years before any overt, dramatic symptoms emerge. I recall a patient, whom I will refer to as Robert, who presented at the age of 71 with no acute complaints. He generally felt well, though he had experienced an unusual degree of fatigue, which he naturally attributed to the natural aging process. During his examination, I observed that his nails were markedly pale, bearing the characteristic reddish band at their tips. Through careful questioning and subsequent investigation, including an echocardiogram, the results unveiled early-stage heart failure that had been insidiously developing for close to 2 years without any readily apparent symptoms. Fortunately, Robert is now thriving. He received the appropriate treatment at the opportune moment, and it was his nails that initiated the crucial conversation that made timely intervention possible. Sign 2. Lindsay's nails. The second observable sign is known as Lindsay's nails, sometimes referred to as half and half nails. Their visual presentation is so distinct that immediate recognition is assured once you are aware of what to seek. The nail plate is demarcated into 2 clearly discernible zones. The portion closest to the cuticle appears white or exceptionally pale, while the half nearer to the fingertip displays a brownish-red coloration. Typically, a crisp, well-defined line separates these 2 distinct zones. Clinical research has linked Lindsay's nails to instances of heart failure and liver cirrhosis, and they tend to emerge following a prolonged period of sustained circulatory stress on the body. Both Terry's and Lindsay's nails represent disorders affecting the color of the nail bed, and both fundamentally reflect the efficacy with which blood is circulating to and nourishing the most distal tissues of your body. When the blood supply to the fingertips becomes compromised over an extended duration, the nail bed loses its inherent healthy pink tone and begins to exhibit these altered patterns. Both of these conditions are readily visible under ordinary daylight, requiring no specialized equipment. I urge you to hold your hands up in good natural light right now and meticulously examine each nail. You can assess for both of these signs in under 30 seconds. It's best to perform this while the descriptions are still fresh in your mind. Sign 3. Murky's lines. The third indicator is called Murky's lines. These manifest as multiple, horizontally oriented white lines traversing the nail parallel to the lunula, which is that small, crescent-shaped, pale area situated at the base of your nail. A critical distinction of Murky's lines is that they are not palpable. Running your finger across them will not reveal any raised texture. While they are clearly visible, they cannot be felt. This tactile absence is a key characteristic that differentiates them from other forms of nail ridging. They are purely a visual cue, not a textural one. The scientific backing for the significance of Murky's lines is particularly compelling. A notable study investigating the relationship between nail findings and cardiovascular disease identified Murky's lines as a statistically significant predictor of heart failure, with an odds ratio approaching 6. The underlying physiological mechanism is that these lines are indicative of low albumin levels in the blood, a common marker of the body experiencing prolonged nutritional and circulatory stress. When the heart struggles to distribute blood effectively throughout the system, the entire body begins to experience the repercussions. I encountered a patient whom I will identify as Catherine at the age of 68. She was an active individual, not overweight, and genuinely felt well. During her visit, she casually mentioned, almost as an afterthought, that she had observed some horizontal lines on her nails over the preceding few months, assuming it was inconsequential. Upon careful inspection, I recognized Murky's lines present across several of her fingers. A subsequent cardiovascular assessment revealed early-stage heart failure that was entirely manageable at that juncture. These lines had been developing for months, a silent plea from her body for attention. Sign 4. Bow's lines. The fourth sign presents a narrative distinct from the others. While most nail anomalies develop gradually and signify chronic conditions, Bow's lines emerge as a direct consequence of a specific physiological event. Bow's lines are recognized as horizontal grooves or indentations that span across the nail plate. They form because when the body endures a significant physiological shock, such as a heart attack, undergoing cardiac surgery, a severe infection, or any major health crisis, the nail matrix temporarily ceases its production of new nail tissue. Upon resumption of growth, this interruption leaves a discernible groove. Over time, this groove progresses towards the fingertip, and its precise location along the nail can even provide an approximate time frame for when the precipitating event occurred. The clinical importance of Bow's lines lies in their capacity to reveal a past cardiac event that the patient may have entirely overlooked. Silent heart attacks are far more prevalent than commonly understood, particularly among older adults, where the classic dramatic symptoms are often absent. I had a patient, whom I will call Harold, who presented for an unrelated medical concern. I observed a distinct horizontal groove etched across nearly all of his fingernails. When I inquired about it, after some reflection, he recalled experiencing a period of severe illness approximately 4 months prior, which he had then attributed to an exceptionally severe bout of influenza. Diagnostic testing subsequently confirmed that he had indeed suffered a silent heart attack during that illness. His Bow's lines served as the silent narrator of an event his symptoms had never fully conveyed. Sign 5. Splinter hemorrhages. Now, I want to direct your focus to a phenomenon that resides beneath the nail's surface rather than on its top. These are referred to as splinter hemorrhages, and their appearance aligns perfectly with their name. They resemble tiny, dark splinters or thin, dark vertical lines that run beneath the nail. Essentially, these are small accumulations of blood trapped within the capillaries of the nail bed. A solitary splinter hemorrhage following a direct physical trauma to the hand is generally not a cause for concern. However, the presence of multiple, unexplained splinter hemorrhages across several fingers signifies an entirely different and more serious situation. In medical education, unexplained splinter hemorrhages appearing on multiple nails are classically associated with infective endocarditis, an infection that affects the inner lining of the heart's chambers and valves. This dangerous condition develops when bacteria find their way into the bloodstream and adhere to damaged heart tissue. The resulting infection can cause microscopic clots to break away and travel through the circulatory system, eventually lodging in distant blood vessels, including the minuscule vessels within the nail bed. Infective endocarditis is a grave condition that necessitates immediate medical intervention. A patient, whom I will refer to as Frances, noticed these dark, splinter-like lines on several of her nails, and during an appointment primarily focused on another issue, mentioned them to me almost as an afterthought. She was subsequently diagnosed with a heart valve infection, which was fortunately caught early enough for effective treatment. She later shared that she had almost refrained from mentioning it, believing it to be insignificant. Sign 6. Lunula color changes. The small whitish crescent at the base of each nail is known as the lunula. While most people perceive it as a mere cosmetic feature, it is in fact the visible manifestation of your nail matrix, the active site where new nail cells are continuously generated. The color of your lunula is among the most overlooked diagnostic indicators present on the entire body. A lunula that exhibits a reddish hue has been significantly linked in research to valvular heart disease and congestive heart failure. Conversely, a lunula that appears bluish or purplish can suggest issues with oxygen delivery within the circulatory system, a finding that can be akin to the cyanosis observed in more advanced stages of cardiovascular disease. A lunula that has noticeably faded to near invisibility or has become exceptionally pale is often indicative of anemia. Anemia places a direct and considerable strain on the cardiovascular system, as an anemic heart must exert significantly more effort to compensate for the reduced oxygen carrying capacity of the blood. All three of these observed color variations warrant prompt medical evaluation. I recall a patient named Dorothy who was 74 years old when her daughter, a registered nurse, noticed during a family visit that the half-moon shapes on Dorothy's nails had all but vanished. Dorothy herself had not registered this change because it had occurred so gradually. She had been observing those same nails daily and had unconsciously adapted to the new visual, failing to recognize that a shift had taken place. Her daughter encouraged her to bring this observation to her doctor's attention at her next scheduled appointment. A comprehensive blood count and cardiovascular workup revealed significant anemia and early signs of cardiovascular strain, both of which were addressed and treated before any serious complications could arise. The capillary refill test. I want to teach you a simple test that you can perform on yourself right now using nothing but your own hands. It's called the capillary refill test, and it provides a direct measure of how swiftly your smallest blood vessels recover from external pressure. Here's how you perform it. Hold your hand at the level of your heart. Using the thumb of your opposite hand, apply firm pressure to one of your fingernails for approximately 2 seconds. You will observe the nail bed turn pale as the blood is momentarily displaced. Now, release the pressure and begin counting quietly. In a healthy adult with robust circulation, the natural pink color should return to the nail bed in less than 2 seconds. If this process takes 3 seconds or longer, and you observe the same sluggish result when testing 3 or 4 different fingers, this is a meaningful indication that your microvascular circulation is operating at a reduced pace. Research has established a correlation between persistently slow capillary refill times in older adults and diminished cardiac output, previously undiagnosed atrial fibrillation, and an elevated risk of stroke. Please perform this test immediately before you finish reading. Ensure you are in a warm environment with warm hands, as cold temperatures can distort the results. A patient, who I will refer to as William, performed this test one evening and counted nearly 5 seconds before the color returned to his index finger. He then tested his thumb, his middle finger, and then the fingers on his other hand, consistently observing the same prolonged refill time. The following morning, he contacted my office and meticulously described his findings. A thorough medical evaluation subsequently uncovered undiagnosed atrial fibrillation, one of the most prevalent and dangerous contributors to stroke in individuals over 60. He was promptly initiated on appropriate treatment, and based on the current understanding within cardiology literature, that single phone call very likely prevented a major stroke within the subsequent year. At the time of his testing, he exhibited no other symptoms whatsoever. Your practical framework. Commencing today, I urge you to take both of your hands to a window bathed in good, natural daylight. Examine each nail individually, systematically working through the following checklist. First, assess the color of the nail bed for any evidence of bluish, purplish, or unusual pallor. Next, scrutinize the very tip of each nail for that distinctive reddish band that signifies Terry's nails. Then, look for the sharply delineated two-tone division that indicates Lindsay's nails. Proceed to identify any horizontal white lines across the nail surface that are visible but not palpable. These are Murky's lines. Check for the presence of deep horizontal grooves, which are Bow's lines. Investigate for the appearance of tiny dark lines situated beneath the nail surface that have emerged without any history of trauma. Finally, examine the base of each nail, paying close attention to the lunula, noting its color and any perceived shrinkage. Following this visual inspection, perform the capillary refill test on at least 3 fingers, counting the seconds with absolute honesty. It is highly advisable to meticulously record your findings. This step is critically important, perhaps more so than most people realize. These physiological changes are often gradual and insidious, and human memory is notoriously unreliable when recalling events over extended periods of months. Therefore, take a photograph of your hands in natural light today. This visual record will provide you with a concrete and objective benchmark for comparison 6 months from now. If you observe one of these signs, make a point of mentioning it during your next routine medical appointment. However, if you detect 2 or more of these signs in combination, do not delay your next annual checkup. Contact your doctor's office this week, clearly describe your observations, and inquire whether a more immediate evaluation is warranted. Before I conclude, if the information presented today has provided you with knowledge you previously lacked, please consider subscribing to this channel and sharing this vital content with someone you care about. This could be a parent, a sibling, a friend who has voiced concerns about their heart health, or anyone over the age of 60 who may not be diligently attending to their well-being. You simply do not know whose life this information might positively alter. Share it now, without delay. One final, crucial point. Please refrain from using any of this information to self-diagnose. The purpose of these observable signs is to equip you with a specific, well-informed reason to engage in a conversation with your physician. An accurate diagnosis is derived from the comprehensive clinical picture, encompassing your complete medical history, current medications, and any other presenting symptoms. Your role is not to diagnose. Your role is to observe, to document, and to communicate your findings. This latter aspect is precisely what most individuals fail to do, and it is the very step that can ultimately make all the difference. For your entire life, your nails have resided at the extremities of your fingers, silently accumulating data every single day about the dynamics of your blood flow, the performance of your heart, and the condition of your smallest blood vessels. The only element that has been absent until now is the key to deciphering this ongoing record. You now possess that key. Utilize it wisely.